We'll go to our next question, please. Tamsin Sargent, sorry.
Thank you. My question relates to supporting people back to work. There are more than 2 million people living with cancer in the UK, and medical advances mean that more and more of us are living with it as a chronic condition. Despite this, there is a lack of support for life after treatment, and in particular in the workplace. Not everyone is in a position to return to work, but what does the panel think can be done to support the estimated 63,000 people in the UK who do want to return to work?
And can I just ask you to follow up yourself on that? And are unable to return to work because they would require a level of support in work that the company or the employer is not able or willing to give? Is that?
I think the key issue that I wanted the panel to consider is the support and understanding that people need from their employers when they return to work after successful treatment. And I think that this issue came up earlier in relation to carers, but I think it's also highly relevant for those of us who do want to go back to work after we've finished our treatment and make a contribution in the workplace.
Andrew?
Well, I think actually this is a growing problem and will continue to be a growing problem because we have improving survival rates. So the numbers of people we're talking about are going to grow all the time. It is a measure of success, but it does bring with it this consequential problem. I think it takes two forms actually. There's the care that people need in terms of medical care, and I build upon the comments that others have made from the panel about how we should be treating the whole of the person, and we should also be encouraging support for the family. I know this is something that Macmillan and the Department for Health have been working upon. I think it's unlikely we can introduce legislation that says this is what you have to do as a company, but I think what we have to do is win the argument by going out there and saying this is how good companies behave. We've already known that there are variable practices. The lady at the front here talked about a retailer who had been fantastic in terms of support. But we also know there are some who are just hopeless in terms of support. So I think it's about encouraging, this is what success, this is what good practice looks like, and then pushing that as hard as we can.
You put your hand up, so yes, there's lots of people with their hands on this one. Just on the edge here with the grey-blue sweater stripe.
Yeah, I was self-employed, so I didn't have a company that would take me back to work. And because of my operation, they removed the muscle out of my shoulder, so I could no longer, I was in construction, so I could no longer go back to that. And over 3 years ago, I was told that the government were introducing a scheme and they'd be in touch with me. And I haven't heard one thing out of them.
Comment just directly on that, Paul Burstow.
I don't know the details of the scheme in question, but I think that there has been really not enough focus yet on what we do to ensure that there is good occupational healthcare support and indeed specialist occupational healthcare support for people making that transition back from treatment back into the workplace, and indeed for those that are wanting to try and maintain to some degree their time in the workplace even whilst they're having treatment. And you're right, I mean the figures are really very disturbing when it comes to the level of employer discrimination, and yet we have an Equality Act that we could be using here to take this forward. I think just quickly is this is not a Department of Health specific thing. This requires something that government isn't always as good as it needs to be at, which is cross-government working. It requires the Department of Work and Pensions, the Employment Service and the Department of Health to work better, and yet in the future to really make progress in these sorts of areas, we're going to need to develop a occupational health service that is as good as the National Health Service.
There are so many hands. I'm going to go to the hands habit, as it were. Fourth row back, gentleman, just second in, and then you have spoken before? No, you haven't. You're next, and then over there. Yes, you sir.
Okay, just a personal situation. I'm trying to get back into work, and I'm being felt that I'm having to lie on my CV now. That over the last 2 years of recovering from cancer, that I'm very proud that I've beaten it, and obviously now I'm recovery. But on my CV, as I send CVs out, and the response I get was, well, what have you done for the last 2 years when I'm recovering from cancer? That's the end of it. And that's what I'm coming across all the time. I even went for an interview, yeah, I'm glad to join, what you've been doing for 2 years, recovering from cancer, you don't hear from them. you're almost being made to feel that you have to lie on your CV, and I'm damned if I'm going to lie on my CV about my last 2 years.
Do you think it's an uncomfortable question for me to put, but do you think that is because of the fact that you've been living with and being treated for cancer, that you've had the time off, or is it simply because the employment situation is not great for the kind of work you want to do?
No, I think it's more that it's because I'm recovering from cancer, over 50 years of age, which doesn't always go for you, but as soon as you're recovering from cancer, an employer will think, well, maybe you'll be off sick again, maybe you'll be ill, maybe you'll be doing this, and I'd rather go for a fitter version. Well, my brain is still as fit as it was before I got the cancer, and I'm ready to go back in the workplace. But nobody will give you a chance once you've got labelled with cancer. The Disability Act allows you, if you need a wheelchair, that they will support the workplace with a wheelchair. They will give them money to bring you back into work, but not for cancer. Any other disability, yes, but not for cancer.
Immediately, thank you there, and then I'm going there, and then you. Yes, ma'am.
I think to qualify for any help at work, you need to declare that you have a disability if you're returning after having cancer. And it was actually something that I was very keen not to do because I'd recovered from cancer and I didn't want it to be a disablement anymore. So I too struggled to find support. I just want to stress the importance of this because as you're in a sort of enclosed institution of cancer care, it feels quite supportive and quite safe. And then as your treatment finishes and it's expected that you return to work because you're well, stepping out of that bubble and that sort of closet is very, very hard. And I think at that point, it's where people need the most help. And I notice that at the moment, the return to work credits for financial support for this is also going as well, so there's a financial element to it.
Would you like, because there are two things there. One is the support you get going back into work, which is a big thing to be doing after you've been ill and having treatment. Would you also like it to be easier to keep going with those cancer groups that you were part of, or because you're cured you don't want to have anything more with those groups?
No, it drops away from you. I had the breast care nurse, I had breast cancer that was diagnosed last July, and the breast care nurse phoned me as my treatment was sort of through the worst phase, and said, if you need me, call me, but that's it basically. In my local area we don't have a cancer support group, which is quite shocking. So I can't.
You would like there to be a cancer support
well,
group?
I'm going to set one up actually.
Yeah.
That's probably why I'm here.
Yeah, right.
But it's down to people like me to do that. I'm a social worker too. But as a social worker, I found it very, very difficult to enter back into the workplace after coming out of the cancer institution.
Because Macmillan, in fact, in our charity, Guys and Thomas's, we encourage people to continue to be part of a group if they've been together with people and have shared the experience and want to go on having that support. So yes, on the outside there, yes, it's you.
What I have to say concerns cancer survivorship very much. I am a cancer survivor, and I'm also currently a facilitator with Macmillan's HOPE programme. And this is a programme of self-management, patient self-management, that has produced miraculous results. We take the patients who are on that cusp between the finish of the medical stage of their recovery, and we deal with the psychological effects of where they've been cancer-wise, and they're considerable. In 6 weeks, with a 2.5-hour session once a week, we can bring these patients out of depression back into living a full life and being able to participate in life and go back to life. The problem is, of course, the getting take-up of the places that are available in the course. Every time we advertise a course, we have to struggle and work really hard, myself and my co-presenters, to get recruits for it. We need the cooperation of the clinics where these people can be identified as being in need of the psychological boost that such a course can give them. We're actually not getting it. There are areas in the country where the course is not available at all. Right? Now, something has to be done about this because it's a very, very important matter. Survivors the amount are increasing year on year. we must get take-up. What can the team suggest we do to make sure that clinicians and CNSs actually advocate this course to the patients?
I need to take one more and then come back to the panel so they can do the essay. There's so many hands. I did promise you, ma'am, just here, and then right at the back on the outside. On the inside, right here first, sorry. Can you, I'm unaware whether we're allowed to be here before being kicked out until 5 o'clock this evening, 4 o'clock, 3 o'clock, 3 o'clock. Oh, we're all right on time, that's good.
It's in response to that gentleman's problem about work. It is actually against the Equalities Act for an employer to ask about a disability during the employment process, and they can only ask once you've been given a job offer in terms of making a reasonable adjustment for that disability. So employers should not ask any questions about your health during the interview process unless you need a reasonable adjustment in order to attend an interview, etc.
So if in terms of the CV that the gentleman was talking about, it should be entirely irrelevant, the fact that he was being treated for cancer. But if they've been asking what have you been doing for the last 2 years, with the implication that either you, for one reason or another, have been unemployable, or you don't want to work, pretty crudely, how would you tackle that?
That's a very interesting question. I'd probably ask them what was their reason for asking the question.
Very good.
So
you got the job.
And work from there. But yes.
Okay, right back there. Yes, on the right down on the inside edge on the left-hand side, about 7, 8 rows, 9 rows back.
Thank you. The gentleman who couldn't get a job, it's quite interesting because I'm in the same situation. I haven't worked for 2.5 years since I was diagnosed with cancer. And in actual fact, under international law, if you lie on a CV, you could go to jail. And again, it's very nice to lady to say there's equality, but when a company learns, they will ask the question, what have you done? I was asked last week, what have I been doing for the last 2.5 years?
Yeah.
And I said I was renovating my house. But when I come to get a medical, they will have to know, so I wouldn't get the job. You know, I've just been earmarked for a job in Europe. I've been headhunted for it, and it's being financed by the World Bank, the Asian Bank, the Islamic Bank, and the European Union to the tune of $1.5 billion. I've been asked to be part of one of their experts. And I'm through the first stage. But I think when I get to the medical, they're going to say goodbye. And I haven't worked for 2.5 years, it's very hard.
Have you had that medical yet, or are you expecting to have it?
Well, I don't know. If I go as a private contractor, I don't have to have a medical.
Right.
But if it gets to a medical...
There's really big things inside what you've all been saying. Who would like to come in? Diane, would you like to start off on this, just to sort of respond, pick up from it what you think is most pertinent?
Well, I think it's a very difficult question because it's these situations are taking place in an increasingly difficult job market, increasing casualisation anyway, whether you call yourself a consultant or a private contractor, you are in effect casual labour, let alone 0 hours contract, which makes people even more frightened to say they need help or to admit they've got a disability. What I would say is sometimes it's for government itself to take a lead, government and local authorities, not in relation to legislation, but in relation to being model employers. Nobody that works for government or works for local authority ought not to be able to get the support they need. And I think that if the government and local authorities were model employers in this regard, giving, instead of shrinking occupational health or doing away with it, having good quality occupational health, organisations like Macmillan would be better placed to debate with the private sector what kind of help they would give. But as I say, it's really difficult in a difficult job market to stand up for people who are coming back to work, having recovered from cancer.
Ciarán, is that true? If public sector, local, national government had best practice in this field, it would make your job easier?
It will, because there's always a high standard to aim for. It's like a model retailer. But it's insufficient. I think we need to do more. We have to say that some of the behaviour we've just heard about is completely unacceptable. And I worry in particular about people who are self-employed or casual labour, and I think that's really tricky. What we are able to do is specific work with employers. We've developed guidance for employers and the HR departments of employers. So getting through the professions seems to be working quite well. We've got a very good scheme with the Trade Union Congress at the moment, trying to do the same thing, but it's chipping away at a really, really difficult social attitude.
Macmillan is a major charity. It's one of the two biggest charities in this field. How great is your reach in this area? Because we all, and I notice do it myself, we do this, we do that, we do such and such, and sometimes you're actually in reality talking about a very small number of people, sometimes you're talking about a very large number. How do you see in terms of your reach where you are?
I think we have to get other people to do our work for us, which is why we're working with the TUC and with Chartered Institute of Personnel and Development. If we can get the profession, the trade bodies, to really believe it's unacceptable that any of their members would behave in the way that we've heard, then we'll get somewhere. It won't be the binary relationship between us and Ford, let's say, who are doing quite a good job in Dagenham. It's got to be much bigger than that.
John?
Yeah, I agree with that. I think we do need to have a holistic approach. In Parliament, there is a tendency, or there is sometimes a rush for new legislation when there's deemed to be a problem identified, without necessarily looking at the existing legislation and whether we're doing enough to make what we have work. And I think, we've got the Equalities Act 2010. We're, as a coalition government, trying to make sure that that's implemented, but obviously there's more work to be done on that, because theoretically, if you look at what the Equalities Act says about this should not be an issue. So certainly I think all of us have a role to play, coming together and saying, look, let's make sure the existing legislation we have actually is implemented on the ground, and from what we hear today, obviously, there's a long way to go.
Is it disturbing what you've heard today, Andrew?
Yes, but I think actually what we've been hearing today is probably something that every MP will hear in their surgeries. And it's very hard to get back into the workplace when you've been out of it for a long period of time anyway. I think it is especially hard when you have gone through something as significant as cancer care. I think it has to be partly through leadership. I support the comments about government nationally and locally leading, but I think it has to be addressed through existing legislation and saying to employers, making it as unacceptable for employers to be having these thoughts as it is now for people to be drink driving or whatever it might be. So it is socially, totally unacceptable. That is what success looks like. That is what we have to do.
Thank you. Yes, one, two more. Yes, on the about halfway down on the left-hand side.
I'd just like to say I work for a government department, and having returned to work from my cancer treatment, the support I've had is exceptional. So good practice is out there. Sometimes it's just a willingness to implement good practice or an unwillingness to implement good practice in some organizations. I just wanted to make that point. Where I feel I would need more support, and from talking to other black and minority ethnic cancer patients, the lack of effective support groups, and in particular, black Macmillan nurses who can help with some of the cultural and emotional needs of black patients. I think Macmillan would do well to consider having advocates for black and minority ethnic people at the beginning of treatment, during treatment, and post-treatment when people feel most vulnerable.
Ciarán?
I take the point. Absolutely. I think whether it's the workforce and it's Macmillan or it's anyone else, I think we have to connect with the people we are serving. And getting that right in Tower Hamlets is very different to getting it right in leafy Surrey. But I suppose the bit I'm struggling with is how do we get to the people who don't want to do it? So how do we get to the people who, we get the model employers, we get the people who want to be model employers and they want to improve. How do we get to the people who can't be bothered, the easy route out is to say no because of ignorance or prejudice or whatever, and that's the bit we find really difficult. It's a version of your reach question, I suspect, Jonathan.
Sorry? A big one?
Sorry, it's a version of your reach question. How do we reach
exactly.
the heart of reach?
This, back there, just opposite where you're standing now, yes, on the outside corner. And then I'm going to, I'm afraid, move on because we need to, so forgive me.
I've been not working now for 3 years, but the company I did work for before have been fantastic to me. Even though I was a self-employed consultant, they still pay me a small retainer. But I can't travel up to London 5 days a week anymore. And I went locally and looked at local agencies, and I've come up against the same thing. The jobs I'm going for are all through agencies, and as far as the agency is concerned, if they put me forward, they've lost one of their chances. Because I've had cancer, and at some point a medical or something will come up.
Last word on this to you, Paul.
I just wanted to go back to the point about psychological support and how we make sure that gets properly embedded into the way in which services operate. I think it's one of the real weaknesses of our healthcare system that we have a sort of silo which is mental health and a silo which is physical health. And yet we know these two things are inextricably linked when it comes to good recovery. So your point about the service you offer, I think, is something which, whether that's the only way in which you can provide tailored psychological support, there are probably other options, but the key thing has to be that the team that is providing the care isn't just thinking about your physical needs, it's thinking about all of your needs, your psychological, sociological and physiological ones, and therefore is embedding as part of your progression to recovery, making sure you're getting access to the right and appropriate psychological support. It's a tailored program of the sort you're talking about, or whether it's access to an IAP service, whatever, but it needs to be part of it, not an afterthought, not something you have to fight to get into separately.
I can't resist that at Guy's, where there is already being built the new cancer centre, and the cancer directorate there is absolutely committed to a holistic approach, and not least because Dimbleby Cancer Care, which is very much involved in that, is going to be providing major support and information services, started when it was looked at by the NHS with quite a raised eyebrow, psychological support services, a long time ago. And one of the great benefits is that more and more people now in the delivery of cancer care, whether it is treatment or whether it is looking after, supporting people in ways around the clinical treatment, are aware of the vital importance of providing psychological support services all the way through people's cancer experience, wherever it goes. Sorry, I shouldn't misuse my role as chair. Actually, I think I should. We go to our next question, please.
No, I don't say that.
When I say local authorities,
What would you say?
I don't know
that
there will be agencies. They're going to be simply to perform the
I don't think it's that possible.
and it's a bit like the question of special needs.
There will be a shortfall. We are last year we're looking at implementing minimum staffing
for a very, very long time.
and then saying you can't have a
What I
minimum
would
staffing
say
level
is